Now, I would imagine when you talk about the actual patient list, okay, you take a look at it. How do you analyze a patient list? Because you've written a fabulous book called Profitable Practice, but what kind of advice can you give to people about taking a look at a client list? For instance, how do you know if they're still a viable client? Do they just sit there forever? If they don't show up for 2 years, are they considered a client?
Yes. Patient count and patient list analysis is a very controversial topic, and every dental consultant and every broker has a little different way to manage it. Ours is probably one of the most simplistic approaches to this topic of all. Get in the cabinet and read the charts, doctor. We can produce all the computer reports that any database can produce. We can give you tabulations and data. The best way for a dentist to understand that client list is to randomly select 1 to 200 charts, spend 3 to 4 hours, and read them. Don't pay a consultant. Don't trust any broker or appraiser to judge what you can judge only as a dentist reading another dentist's charts and record keeping. That is your best investment in time during the acquisition and investigation of a dental practice. However, we do have a lot of data accessibility that can support that. We know recall counts, we know repeat rates of certain patients returning, we know the fees, we can do an age demographic with the aid of most dental software. We know dates of birth, because all dentists have to record dates of birth, so we can do an age analysis. We can certainly do a zip code, or in Canada we do a postal code analysis to show where they are populated in relation to the location. Are they mostly from the west? Are they mostly from the north? We can do other ethnic demographic studies, mostly just by going through records and looking at names. Certain dentists attract certain ethnicities or from certain cultures or communities. That's usually done by names. There are other referring sources that are often recorded. So there can be a science to this, and in fact in the book we talk a little bit about the science of due diligence. This is how you go about analyzing and investigating a dental practice before you spend $500,000 or $1 million. There are ways to do it. Many brokers that are in the business today are brokers of other types of businesses. They don't uniquely understand dentistry, so you may not get all the information you need from the broker. And let's be honest, in most cases the brokers are working for the seller, so their job is to close a deal. And educating a buyer, I think, is incumbent upon us. And most brokers, if they're licensed, which we are, have a fiduciary duty to help that buyer because they could be a future client for us in 25 years. By example, how many times have you sold a property to someone who called you 5 years later and resold it? That's repeat business, and that's what brokers are really in. At least that's what our family business is in. So we would help the buyer get through this due diligence. Good question.